welcome to the San Diego Mesa College evaluation training video. My name is Kathy Boychuk, and many of you know me from coming out to clinical visits, etc. But certainly I don't know every technologist in San Diego, and the idea behind this video is to help you in the evaluation process of our students. These are the same students that will someday be taking your x-ray, and watching this video hopefully will help facilitate your understanding in what we're looking for and the importance of your participation in the grading process of these students. So while watching this video, you'll have a questionnaire, and I want you to answer those questions and then ultimately give that to your CI. This video is going to show a demonstration of a technologist that is not doing a very accurate or good job of evaluating a student. Then it will show a segment which has a technologist that is doing a good job of evaluating and watching the student. Then the next segment will be a segment which is from one of the clinical instructors that is supporting the idea that your participation in this is invaluable, essentially, and that you are creating the future technologists. And the last part of this video will be the students themselves. And hopefully what you'll glean from this is that when you do evaluate a student, you are not trying to necessarily be the student's friend. You're trying to do a fair evaluation, and you and the CI and myself try to tell the students that this is for their betterment, and not to take the evaluation personally, and to take it as a constructive way to improve, because ultimately we're trying to produce the best technologists that we can. And once again, I would just like to really thank you for your participation working with our students and in the evaluation process. And I hope you enjoy our little video. We had some fun and some nervousness making it. Thank you.
Hi, my name is Marge Mongolo, and I'm the clinical instructor from the VA hospital. As clinical instructors, we have responsibility to the staff and the students on how the evaluations for the students are filled out. As clinical instructor, if you do not feel that an evaluation you received from a technologist is valid, please go back to the technologist. Make sure that the scores that they gave the student were appropriate. They account for a majority of their score for their semester, and it's very important that these evaluations reflect the student training. Thank you. For the standardization of technologists on how to do evaluations, I think it's important that we know what's expected of the student for each exam. Always read the entire request first. Compare the history and diagnosis, and verify the history and diagnosis of the patient. Greet patient by using their full name and introduce yourself. Escort the patient into the room. Introduce a technologist if a technologist is present. Once inside the room, make sure you verify by 2 identification methods, whichever your hospital uses. Female patients of childbearing age, please ask if they're pregnant. That is a requirement. Explain the exam to the patient in layman terms, meaning how the patient would understand it if they were not medical. However your hospital uses the RIS system and the PAC system, you need to be familiar with that and how to use it, how to bring up a patient, how to bring up an exam. Develop a plan for imaging. It's very important to have a routine as a student. If you have a routine and each step is in that routine, things will not be forgotten. You must follow the imaging protocol for your hospital, and then set up a way to do an exam where it makes sense. All the APs and all the laterals. However it works for you, but you need, once again, to set up a routine. Assist the patient onto the table. Set the appropriate distance for your tube and bucky, depending on which exam you're doing. Make sure that you are properly centered. Make sure there's a marker on the plate. Set a technique, using the technique charts, which I'm sure are available at most hospitals or all hospitals. Position the patient according to protocols. Position the patient according to what you've learned. Watch the patient at all times. Do not turn your back on the patient. You have a little window, make sure you look out of it. Make the exposure. and process the image according to your hospital protocol. If a patient asks you about the results of an exam, you are not qualified to make that call. You tell them that the results will be to their doctor within the appropriate time as given by your hospital.
Carolyn?
Yeah.
Hi, I'm Maria.
I'm
Come
Maria.
on back. I'm gonna go ahead and take your x-ray.
Okay.
You're having pain in your shoulder?
Yeah.
Okay, go ahead and lay back right here. Your head right over there. Which shoulder is it?
This one.
Right side?
Yeah.
Okay. What type of pain are you feeling?
It's kind of all over.
All over, okay. All right, well, let's go ahead and get started with the x-ray, okay?
Okay. Does it matter? Your window's dirty.
Oh, no, that's fine. It shouldn't show in the x-ray. Put your arm right here and hold it just like that, okay?
Okay.
Don't move.
Okay.
Yeah, it looks good. Go ahead.
Exposing. Beep. All right, this time what I want you to do is roll to your side like this. Right there, right there, just
Okay.
like that.
Okay.
Hold it just right there, okay? Don't move.
Okay.
All right. Don't breathe, don't move.
Go ahead.
Okay, shooting. Good job, Carolyn. That's it.
Okay.
All right, Marge. Our 2-week evaluation is due. Would you mind doing it for me, please?
Sure. It's almost lunch, isn't it?
Yes. Oh,
Good.
yeah.
All right.
I'm starving.
Let's give you this one. Yeah. Nice shoulder down. Thank you.
Perfect.
Well done.
Thank you. Wow,
50,
great.
nice.
All right.
Good
All
job.
right.
As technologists, we need to be aware that we need to properly evaluate all the students. Things that were done wrong in this exam were, number one, when the patient was brought in the room, it was first name basis only. We didn't use 2 identifiers to identify the patient. We moved the patient to the table, asked which exam we had to do by the patient. We didn't look at the request. We need to read the request and figure that out too. Positioning. Positioning was all wrong. Second view that she did over here, she rolled the patient on their side. Clearly, that's not a shoulder view. Okay? Yet, at the end of the exam, when we're all done, she got all 5s. And a 50 for the 2-week evaluation. Okay? Unacceptable. The evaluation form is supposed to be used as a tool to enhance the learning ability of the student. Okay? Don't be afraid to put less than 5s on here. If the student needs help or needs improvement in some areas, we need to know that. They need to know that. It's not personal. Okay? The only way that we can help a student get better is to truly evaluate what exactly they do.
Maria? Hi, Maria. Could you come with me for a second?
Yes.
My name is Carolyn. I'm your technologist today. Could you please tell me your last name?
12,
Okay. And your birthday?
12, 24, 25.
Okay, great. Maria, is there any chance at all that you're pregnant?
No, but you know what? I feel really, really dizzy.
Oh, okay. Well, we'll get this done real quick then.
Okay.
Okay, I want you to come in here. And, you know, oh, hold on. I have to set up the room. Can you stand over here for just a minute? Okay. This won't take very long. Oh, whoops. I went right past it. Alright, you doing okay?
I'm like really, really busy right now.
Busy? Okay, I'll try to hurry.
Maybe what we should do is ask the patient to sit down because if
Oh,
she's dizzy,
okay.
how are you feeling?
I'm really, really busy.
Okay, I'll tell you. Why don't you have a seat right here,
I
okay?
feel really
Can you
sick
make
right
it?
now.
Can
Yes.
you make it?
Yes.
Okay, have a seat. How are you feeling?
Better. But I'm really, really busy right now.
Okay, well, we're just going to have you sit here for a
Just
minute.
hurry up with the exam,
Okay.
please.
And let us know if it gets any worse, then we're going to have you sit on the floor, okay? Because we don't want you to fall, and I'm going to stand behind you for a minute just to make sure everything is okay.
Okay, thanks.
How long have you been dizzy?
Since I got here, and then I waited in the waiting room for an hour.
Okay. Okay. We think you're okay sitting here for a couple minutes?
Yes.
Okay. So I'll tell you what we're going to do is, do you think you can stand up and we'll move the stool for you? We're going to
Sure.
take your x-ray and we'll take it sitting down, okay, Carolyn?
So do the AP then?
Sure.
Okay.
Okay. So we'll have you stand up. Are you okay?
Yeah, just
Okay.
hurry up with the exam.
Okay.
Okay, I'm just gonna sit down right here. And I'm gonna put a board behind your back. Okay, so hold still, and then you can lean against the board. I'll do like that. Okay, you still feeling okay?
Just hurry.
Okay, alright. Okay, I'm trying. Close your eyes because I kind of. There we go. There. And then there. On your shoulders. Okay. There. I think we got it.
You might want to center a little bit lower because
Oh.
we're
Okay. Let's see. Oh, okay. And
just with the bucky.
yeah, and you ready up?
Mm-hmm.
Can I bring you over just a little bit? I'm just
Okay.
gonna scoot you just a hair. All right, right like that. Let me see where we're at. Okay. And let's see where we're at. It's hard to see with these lights. Okay, I'm gonna move this on you, okay?
Mm-hmm.
Right about there. Should be good. Let's see. Let's see. I'm gonna make it bigger. Oh, it's still too hot, huh?
That's probably getting there pretty good.
Okay.
Any markers in there, so that looks nice.
There. I'm covering the cassette. Alright. Okay, and then I think we're good.
Still okay?
Yes.
Okay,
hurry
we're
up.
almost okay.
Okay, there's one thing we forgot we gotta do. Can you hold this by your side? Would you be okay with that? It just protects you.
Yes, thanks.
There we go. Right like that. Okay. Okay, what I need you to do is, can you take a deep breath and hold it? Don't move. Okay, go ahead and breathe.
Do you need to lie down?
Yeah, maybe.
Okay, I'll tell you what. We're gonna have you go over on the table here and lie down for a couple minutes, and we'll get our nurse to see if you need any additional assistance. Okay?
Okay, thanks.
Okay. Can you go?
You okay?
Yes, I'm fine too.
There we go.
Alright.
Hi, Kathy. I don't know if you know, but our 2-week eval is due. Would you mind filling that out for me?
Sure, no problem.
Great, thanks.
It'll take a couple minutes.
Okay.
Okay. Wow, thanks, Carol. It's been fun working with you, and here's your evaluation.
Okay. Can I ask you about some of these?
Sure.
Okay, so the technical positioning, you marked me down? What was?
Well, I did, and the reason I did that, and I made some comments on the back, is that basically, and especially as a second-year student, and even as a first year at this point, you should have done a fair amount of chest, and you really need to focus on centering a little bit lower. You'd gotten a fair amount of her C-spine, and that was unnecessary.
Okay.
So that could be improved. You also, when the patient states that they're dizzy, first thing that should go through your mind is how dizzy are they? So continual assessment and always potentially assuming the worst in that the patient may faint. And then therein they will injure themselves when they faint. So once we got her on the stool, she seemed to be okay with that. But boy, having a patient faint is one of the worst things that can happen to a technologist. So the next time when a patient gives you any indication, once we got her on the stool, you really, and I marked this on the positive part, you really seemed to be more focused on the fact that she had mentioned that she was dizzy.
Yeah.
I also indicated for positive things, your marker placement was good, and the corrective action that you took once we kind of thought, okay, she's going to be sitting, was good. The other thing, and we'll take a look at this together, is so when I marked you, the one area that I think that needs improvement, and that's a 3.2, is that it's this one. So the student demonstrates safe equipment operation and supportive care to all the patients. Had she fallen down, that could be an incident for the hospital, and we just don't want that to happen. So
that's true.
Yeah. The 5, you did really good, and I could have put this on here that you thought to shield the patient. We should be shielding all patients that are potentially female patients within the age of pregnancy. The other thing I would suggest, and actually I didn't indicate this on here because I was sort of running out of space, but be sure to correlate the exam, meaning the chest x-ray, with the symptoms that the patient is having. So when you read the requisition, okay, and you're here because you're coughing or not feeling well, so that whatever the requisition says ties in with the rationale as to how are you feeling and why are you here. I always ask that of the patient because then I look at the requisition and make sure that they seem to be correlated.
Yeah.
But other than that, anything else that you want to ask about on here?
No, I appreciate your feedback. I usually am more safe, but yeah, I just wasn't thinking today, so I understand.
Well, you may have never encountered that situation.
The dizzy fainting.
That's what being a student is. There will be things that happen that you haven't seen before, and so it's a learning process.
Yep.
And I'm sure that the next time it happens, you'll be thinking about a stool and having and having the patient sit down. And so go ahead and fill out your section and then give this to your CI.
Thanks for your feedback. I
Yeah,
appreciate
it was great working with you. Hope to see you back in my area again.
Okay.
Well, another thing I'd like to do is I'd like to introduce you to 2 of the students that are currently in the Rad Tech program. This is Carolyn Freeman and Maria Tolentino. And I'd like to ask them a question, and the question is related to the evaluations that you as technologists fill out. So, Carolyn, what does this mean to you when you look at an evaluation and you're getting it back from a technologist and they filled it out? How do you feel about the comments on this?
Well, the first thing I do is I go through to see what I did well and what I did wrong, and I pay attention to mostly to the things that I didn't maybe get as high of a score as I thought I should have, and then I want to know what it was that I maybe did wrong. So I will try to ask that person what it was I should have done better so I can learn from the experience, because this is my time to learn and for them to teach me. And I also go to the notes in the back. The more specific they are, the better they are to me, because then again I can learn specifically what I did well and why maybe I didn't do so well, and so I can take that chance to improve.
This is Maria, and Maria, you just got an evaluation, and wow, you got all 5s on your evaluation. So how do you feel about your evaluation?
Well, honestly, having a perfect score makes me really feel great. But knowing myself, I know that there's still a lot of things that I need to improve on. So when I see this and I see a 5, I don't necessarily go to the tech and say, why did I get a 5? When I know that I didn't really do well on it. But the way I do it is I just grade myself on the student section. And I kind of just realize to myself that these are things that I really need to improve on. So I appreciate a tech giving me a perfect score, but as a student, this is probably not a reflection of the things that I need to improve on. Because as a student and where I stand right now, I know that there are still a lot of things that I need to learn and improve.
Students don't or shouldn't take the comments on here personally, and students should invite constructive criticism, and technologists shouldn't feel that if they write something in the area that the student needs improvement, that that is a negative thing. That should be seen as a positive thing. All students should want to improve, and all techs should continually want to improve. And if we don't help each other, then sometimes that won't happen. So when you're filling these out, try to reorient your thinking and think about this as a positive thing. And I would say this to the student as well, that this is not a negative thing. This is not a personal thing. This is a professional development, and at all times we're always trying to be the best technologists and the most professional technologists that we can be. And by the same token, the area where the student excels, the students need kudos just as much as anyone else. So when they've done a good job, then they need to know exactly where they've done a good job. And if there's any little thing that they could do better on, then they absolutely want to do better next time, and it needs to be reflected on here. So thank you for and the students want to say thank you for evaluating you and for the time that you put in and training the future technologists.